You guys, let's just talk about hypoxia in utero versus hypoxia when they're out. So you guys, tell me what babies do in utero to mature their lungs. Breathe. They breathe amniotic fluid. So is amniotic fluid essential to a baby? Yes. For growth and development. Sorry, Justin. Okay, so you guys, when we suspect that a baby is hypoxic in utero, we know that the hypoxia is from uteroplacental insufficiency somehow. Either the mom's not getting enough oxygen there, or the placenta is damaged, right? And so the baby doesn't get it, or there was an event and the baby was hypoxic. So we're like, or let's just say the baby's not moving. So they come in and they see us and we say, the provider says, okay, I'm going to do a biophysical profile. Okay, a biophysical profile. Now this is in utero. So the parameters that we're going to assess on a biophysical profile, does anybody remember this from test 1? Amount of amniotic fluid. Okay, what do they use the amniotic fluid for? Breathing. Okay, if a baby is hypoxic, tell me about their tone. They are flaccid. So here would be fetal tone. And then this one is, so there's 1, 2, 3, 4, 5. The 5th one is okay, so fetal tone and then fetal movement. And then the 5th one is a NST. And this would be a reactive NST. Now, dudes, tell me this. We need enough amniotic fluid so that they can breathe, right? So they can't breathe if they don't have this, right, you guys? So is breathing a good thing? Yes. Fetal tone, what do you want them to be in utero? Flex and not flaccid, okay? Fetal movement, do you want them moving in utero? Yes. And then, do you want a reactive non-stress test? Okay, so dudes, all that an Apgar is essentially a biophysical profile outside with just a one color caveat. So dudes, here we got heart rate. So we're looking at the baby's heart rate when it gets out, okay? Here, respiratory effort. Do you want them to cry? Yes. So dude, look, here's heart rate, here's respiratory effort, okay? How about this? Irritability. So dudes, here, fetal tone, and this is here's tone. Huh? This is muscle tone. I should have put it. And then last one is color. Okay, so dudes, muscle tone is the same thing as fetal tone. So when a baby comes out, do you want it flaccid? No, dudes, you want it well flexed, right? And then irritability, which is not on here, this is the amniotic fluid one. Dudes, when you irritate this baby, should it just lay there? No. We had a baby in Orange Park.
I have a question about that. Would his,
Apgar?
yeah, no, would his demeanor, the way he was, could that be because of the nuclear cord?
We don't know. I think he was hypoxic. I mean, the way he looked, he had good tone, but he had no reflex irritability. This is called reflex irritability, actually. So this is like you rub them, and they should go, ouch, I don't like that, and they should cry, okay? Because they just don't like the stimulation. So, I don't know, it could be. And then color. So this is the other one, color. So you guys, this is the same thing as this. This is just in utero, and this is out of utero. You guys see that? We're looking for a hypoxic kid that's flaccid. So dudes, it's easy to remember the Apgar because 0 is nothing. That's no heart rate, no cry, no crying. This is like a, what is this like, dudes? Tell me another scale that you guys do this one on. Glasgow Coma scale. Do you want them to be irritated yes, dudes. So this one, if there's no irritation, this is bad. This is not good. Muscle tone, flaccid. And then color, so you guys, when they come out, they haven't oxygenated a ton. So sometimes the first color is 0. And then the next color is 1. And that's fine. These are 8, 9 Apgars. That means all this. But do you guys see how the hypoxia thing and the respiratory thing is the same from here to here? It's just in utero and out of utero. Don't try to memorize things as much as understand them. So we're going to give Apgar at 1 and 5 minutes. Dudes, if the 5-minute one is less than 7, we're going to do another one. Because what does it mean when it's less than 7? Our baby's having trouble, right? We've got a baby that's not doing well. So we need to keep monitoring and filling the chart. Dude, why do we even do an Apgar? Let me just ask you all that. Well, liability, but dudes, well, yes, we're trying to see what do we have on our hands, but dudes, why we document the Apgar is we're trying to see, was this kid hypoxic at birth? Because when this kid is 10 years old and there's a massive developmental delay and the Apgars were good, there was a good labor, can we look back and point it to the labor and say that that was the cause? Do you see what I'm saying? If the Apgar is 0, 2, 3, yeah, we probably can. Or what if the Apgar was 8, 9, and now we've had something happen, you're saying that was not a birth injury. Do you guys see that? Which from hypoxia. Sabrina?
So at Orange Park, there was a kid whose first Apgar was 9, and then his second one was 7.
Okay.
So what does that mean?
He had some trouble. After that 1 minute, he started having some respiratory trouble. So, yeah, we don't want them to go down. And if they're low, if they're under 7, we're going to keep scoring them to say, did this kid come around? Did they come around? Did they start breathing? Did they start crying? How did they do? So you can see here it is again, heart rate, respiratory rate, muscle tone, reflex irritability, and genomic skin color. Here it is. So dudes, if you memorize 2, and you know that 0 is nothing, then you know what 1 is. Is everybody following me there for teaching techniques? Just memorize 2. And if it's at least on the scale, some here, then you know it's not absent. And that's a 1. Is everybody good? Do you get it, Amanda?
I do. I had a baby that had a 5 and a 5, and it was just drama, and I think it was just charted incorrectly, and I'm thinking, how did that happen?
That's terrible. A 5 is really low.
Yeah, and then they didn't redo it at 10 minutes.
Oh no.
Yeah, I'm having that moment right now.
See, dude, that's standard of care. Like, this is something you learn in nursing school, that until it gets over 7, you keep doing that up until like the first hour, dudes. And that's like serious stuff. So when you look at these, look at this, dudes. 0 to 3, severe distress. 4 to 6 may need blow-by, but not a full resuscitation. Hold on one second, Anna. And then 7 to 10 is no difficulty. Go ahead, Anna.
Every 5 minutes?
Every 10 minutes under 7. Well, 5 minutes, do it again at 10 minutes, then 5 minutes. If it's less than 7, you can do it up to an hour. So you guys, we know that there's, what if it's like 8, what was it, 8, then?
It was 9 and then 7.
What if it's 9, 7, 5, 3? Bad, dudes, bad. What if it's 3, 3, 3, 3? Not good. So when you look at these Apgar scores, and the nurse is the one who assigns them. And can you pause that for a second, Justin?